Howdy! Welcome to our instruction video for the new SAM XT Tourniquet device. We will continue to carry the SWAT T-bands for use as pressure dressings until they run out or expire. However, if a tourniquet is required, you need to use a windlass device. As a reminder, windlass devices are the ones that have a strap that is tightened and then a bar or additional tightening. Some FROs and other first responders may use the CAT tourniquets. All non-FRO vehicles will now be equipped with the SAM XT tourniquet device. Both tourniquets are recommended by the Committee on Tactical Combat Casualty Care /PHTLS. This new device will seem familiar if you have experience with a CAT tourniquet, but there are some key differences that we will cover. The most important difference is how the device is tightened. The SAM XT has an auto-locking mechanism that engages holes in the strap and takes out the slack and maintains the tightness. We are all familiar with the SAM Sling pelvic binder. This buckle is very similar. The rationale behind this feature is that excessive slack is the main cause of failed tourniquet application. It also ensures fewer windlass turns are required and hopefully less application time. Furthermore, the buckle cannot be disengaged when the windlass is in place, therefore preventing failure even if the Velcro loosens. Now let's cover the application of the SAM XT. First, if possible, expose the extremity, locate the site or sites of the injury, and place the device around the limb 2 to 3 inches above the most proximal wound. If clothing cannot be rapidly removed, it may be placed over it, but avoid pockets and remove any solid objects or inside the clothing. In some cases, bleeding is unable to be visualized due to the extent of the injury or scene conditions. In this case, place it high and tight, meaning as near to the patient's torso as possible. Do not place directly over a joint. If you do not have room to place 2 to 3 inches above the wound before overlaying a joint, place the device just above the joint. Next, insert the tip of the strap through the opening in the buckle and pull the strap hard and steady until it stops. You should hear an audible click. If the prongs do not deploy, continue pulling slack until it is removed and the prongs engage. While maintaining tension, press the strap back upon itself to engage the Velcro and hold it in place. Do not cover the C-hooks or windlass yet. Now, begin turning the windlass in either direction until bleeding is noted to have stopped and there are no distal pulses palpable. Then, place the windlass rod inside the C-hooks and confirm the bleeding has stopped. If bleeding continues, try to further tighten the tourniquet with the windlass. Wrap the strap between the C-hooks over the rod and around the limb. Secure the gray retention band with the clock over the windlass and record the application time. If bleeding is still uncontrolled after the application of the first tourniquet, place another tourniquet side by side to the first. This tourniquet is approved for use for patients with extremity circumference from 5.75 to 32.5 inches. For reference, the mid-thigh circumference of a 3 to 6 month old is about 6 inches. The plastic plate can bend on smaller extremities without breaking and to facilitate placement. We would recommend holding the windlass when applying the device to lower extremities to engage the buckle successfully. For more information, please visit the link provided.